we are looking at the immunomodulators. So firstly, looking at the cyclosporin or also the tacrolimus. So here the mechanism of action and the uses. So it is a calcineurin inhibitor. That is, it reduces the IL-2 transcription, and it is also a first line drug for the GVHD. Now looking at the side effects. The side effects, it includes, it is common, whatever is common is hepatotoxicity, then also the hyperkalemia and the hypertension as well. Next, there is also the nephrotoxicity and also the neurotoxicity. There is hyperglycemia as well. Now, looking at the cyclosporin. So in case of the cyclosporin, it can lead to the hirsutism, gums hyperplasia, hyperlipidemia, as well as the hyperuricemia. Next, we look at the drug Everolimus and the sirolimus. So the Everolimus and sirolimus, it is the mTOR inhibitors. So what it does is it inhibits the CDB proliferation at the G1S phase. So the side effect here is that hypokalemia. It is the side effect. Next, we look at the azathioprine. So the azathioprine, it is a prodrug of 6-mercaptopurine. So looking at the side effects, it leads to the bone marrow suppression as well as the hepatotoxicity. Next, we focus on the drug basilizumab. So the basilizumab, what it does, it blocks the IL-2 receptor as well as the CD25. It is used for the prophylaxis of the acute graft rejection. Next, we look at the Microphenolate mofetil. So this Microphenolate mofetil, what it does, it blocks the IMP dehydrogenase, and this ultimately leads to the block of the purine synthesis, and adverse effect being it causes the GIT upset. Next, we move on to the drug, the Leflunomide. So what this Leflunomide does is that it blocks the orotate dehydrogenase, and this leads to the blockage of the pyrimidine synthesis. Now, looking at the adverse effect of Leflunomide, it leads to the bone marrow suppression as well as the hepatotoxicity. Next, we look at the MuroMonab. So this MuroMonab drug, it blocks the CD3, and looking at the uses, it is used for the acute graft rejection as well as in case of the rebound rejection. So the adverse effect of MuroMonab is that it is a cytokine release syndrome. Next, we look at the drug, the Belatacept. So Belatacept is a CD80 and 86 inhibitor. Next, we look at the alimetuzumab. So alimetuzumab, it is nothing but a CD52 inhibitor, and then we look at the belumosudil. So this belumosudil, it is a Rho kinase inhibitor. Lastly, we look at the thalidomide. So this thalidomide, it is anti-inflammatory as well as anti-angiogenic as well as neoplastic and an immunosuppressant. So the adverse effect here is that there is the adverse effect is the phocomelia mechanism. So here there is a block of the cereblon and the tubulins. So it leads to the block of the vasculogenesis as well as there's increase in the free radicals, and this leads to the block of the fetal organ development.